Servus Männer, it's Red Pill Germany again. If you look at the official numbers and stats during this health crisis that we have at the moment, you can clearly see that in many Central European countries, the situation has improved markedly and the trend has actually been turned around. This is why many governments are already debating about possible scenarios or possible schedules out of our crisis mode right now. They want to discuss different ways to lift restrictions that were imposed in recent months and weeks. The first country in Central Europe was Austria, but today also Germany discusses on the federal level to formulate suggestions for the states, for the federal states in Germany. This is actually how it works in a federal state. I will explain that today. But first in this video, I want to go over the numbers quickly. I will tell you what the key figures are right now as compared to the beginning of this crisis. Then I will tell you what the federal government actually decided or what their suggestions are. And then I will tell you what I think about that. But before we start, a big thank you goes out to all my subscribers and my supporters. Please share this video if you find this information valuable. And if you want to support my work, consider making a donation via PayPal or supporting me via Patreon or Subscribestar. Alright, so a couple of weeks ago when we were at the beginning of the current developments, it really made sense to look at the number of cumulative cases or the number of total cases. This is a number that just counts all people that were ever tested positive in the different countries, and this number by definition can ever only go up. It can never go down. When you are a couple of weeks in, however, this number is not really what you want to look at. It also is still valuable information, but what you really want to look at is how many active cases a country has at the moment. So that means how many open cases there are still currently. And that is, of course, the total number of people minus the people who have already recovered or that are no longer with us, that succumbed to the affliction or to something else. But in these Central European countries that I want to look at today, the mortality rate here is comparatively low, so that the number of open cases is primarily driven by the number of new infections each day minus the number of recoveries each day. And when you look at Austria, Switzerland, the Czech Republic and Germany, you will see that the number of recoveries each day exceeds, and in some cases clearly exceeds, the number of daily new infections. The mortality rate, as I said, is comparatively low anyway, so that means that the number of open cases or active cases goes down. And this means that not only the trend of exponential growth that we had in the beginning, but also the trend of overall growth has been turned around. This is very clear right now. There are other countries that made at least a dent, like Poland, for example, but they're not yet there where one can clearly say that they have turned it around. Other countries, like Slovakia and Hungary maybe, I would say that the data is just not clear enough, or there are not enough overall cases to determine whether or not they actually turned it around already. But I think it is safe to say, when you talk about Czech Republic, Germany, Switzerland, Austria, there are many cases, there was a lot of testing, the numbers look clear, the curves don't look noisy, and one can clearly say, yes, in these countries the trend has been successfully turned around. In the UK, in Spain, in Italy, in France, this is not the case yet. The numbers of active cases are still rising in those countries. And I don't really want to comment on why that is. That is up for debate, or up for speculation rather. The fact is that Germany has already started to take in patients from other countries. because the capacities that we have in our medical system are much bigger than what we need for our own patients at the moment. So the question is, of course, in how far that was due to the measures that we have taken, but I think it is rather plausible to say that if you have a contact ban, or if people cannot visit their families anymore, if people work from home, if they're basically stuck in their apartments and they're not interacting with other people, I think it makes sense to assume that the spread of a pathogen would be severely limited and slowed down in this way. And then the people who recover are actually bringing down the number of open cases significantly while you limit the spreading of the pathogen. I think that makes perfect sense. So then the last thing that we want to do, of course, is that we would all of a sudden go back to normal, and then we would have exponential growth again. That is, of course, the fear now of all people who have some responsibility in the political field, our leaders. They are afraid now that if they take back the restrictions too soon, we will have suffered and we will have paid in vain, and we just postponed this exponential growth a little bit. We just stalled the process. We didn't revert anything. We will still have exponential growth because large parts of the population still don't have any immunity yet. And this is why I find myself in the funny and rather unfamiliar situation that I agree more or less with what our government is trying to do at the moment. In a previous video, I have already described that I think that we should actually take back a lot of these restrictions, but of course maintain others. We must restart our economy again, but without risking to fall back into an exponential spreading scenario. So let's go over the points that our federal government put down in their list of suggestions to the states. And before we do that, however, I still want to clarify that yes, our federal government, they can control some things. For example, border controls or something like that, or travel bans, they can do that. But what happens within the states, they have actually limited authority here. So we are a federal state, and the different states have the authority in certain questions. For example, if I can drive into the mountains to hike there for a couple of hours all by myself, if I'm allowed to sit on a park bench and read a book, or if supermarkets, pubs, restaurants, massage parlors, or hairdressers are allowed to operate right now. All these things are decided on the state level, and in some cases, if there is a local hotspot, even just a community can take measures for that community alone. So what Angela Merkel and her team formulated now is a suggestion catalog for our member states. So what is most important for most people, I would say, is the contact ban. That means so far people are not allowed to actually meet people that they don't live with. So I'm normally living by myself, and that just means I'm not allowed to visit anybody. I can't visit friends, I can't have them over at my place, and I also can't visit my family at the moment. And this should stay like that until the 3rd of May, and probably even longer. Then small businesses such as car dealerships or bookstores or something like that, until a area of 800 square meters, they say, they should open again. And some more critical venues such as hairdressers, for example, they should also open up from the 4th of May, but only under certain conditions. So the hygiene requirements were increased for these places. For example, people are not allowed to wait in a small waiting area in the store. And I think it is also then maybe compulsory to wear a facial mask. I have seen that at the post office, for example, you were not allowed to line up in the post office, but instead there were these markings on the floor, and within every sector or zone, only one person was allowed to stand. So that makes for longer lines, but they make sure that you keep the distance, that personal space or social distancing is still guaranteed while you wait in line. they said that a travel ban also within the country. So as I just mentioned, for example, if I want to go hiking somewhere, this is also a form of traveling, and that should still remain banned. So I think it is mostly about starting the economy and less about improving our lives, our personal lives, our personal liberty. So they are worried about the GDP, but they're not so worried about our quality of life. And maybe you can make an argument that this is reasonable right now. So when it comes to religious gatherings, and I just made a video about that concerning Easter. We just celebrated Easter. Oh wait, we didn't celebrate Easter because it was banned in Germany to celebrate Easter. Because religious gatherings are still banned, and they say that they will remain banned. However, other voices said that they could imagine that soon there will be a lifting of these restrictions. So already this week there should be a discussion about lifting the bans of religious gatherings. And I wonder, why now? I mean, Easter is over and now all of a sudden they want to allow religious gatherings again? I don't really know why. I mean, is there some religious thing that maybe starts at the end of this month, maybe? Maybe next Thursday, April the 23rd? Is there something that starts there? I have no idea. But for some inexplicable reason, our government seems to be motivated to have a discussion on that right now. Very, very curious. All right, so this is the overall situation right now, and some measures are being discussed at the moment that can be reverted. So my personal opinion, I stated many times already in previous videos. So I think it was important that we took decisive temporary action, and now is the time when we should really think about what we can lift again, because our economy is really suffering. I'm not so affected personally, but a lot of people are suffering. Their businesses are in danger and a lot of jobs could be lost. So I wouldn't just frame this in terms of GDP. I think in this situation that needs to be translated to a more personal level. If we actually just shut down our economy, that will cost a lot of families their income, a lot of privately owned businesses, small or mid-sized businesses will go bankrupt. They cannot afford these measures like a large corporation or a multinational corporation. They are able to deal with that and to mitigate the damage in a much more effective way, and they have other ways to survive this. I also think that the measures that don't really cost us anything, like wearing of masks in public, or some of the contact bans, I think it makes sense to maintain that. I think nobody wants to be in a situation that we now think that we have defeated this crisis and then the numbers go up exponentially all over again. And at the moment, there is no reason to assume that this wouldn't happen. So I have to admit, I find these contact bans and these travel restrictions, I find them extremely unpleasant. And of course, I hope that we don't need them anymore very soon. But I also see the danger, of course, that we would get exponential growth of open cases again if we just allow people to go to pubs and to party again. There is actually a discussion in the German economy right now if some regions should go back to work sooner than others, because it is quite inhomogeneous in Germany actually. Some regions are affected heavily, some aren't, and that is due to the fact that in some areas a lot of people have the option to work from home. This is more service industry heavy areas of Germany, whereas areas where stuff is produced, where you work in a factory, where you actually have to be on the shop floor working in a production line or with a machine, there you cannot work from home obviously, and this is why these areas are hit much harder. And then you can also calculate, for example, how much GDP these measures costs in different areas. I mean, this is all nice and good, but I think if it's now 1% or 2%, the bottom line is it hurts the economy. And this is why we need to find a compromise between returning back to business, but also limiting the spreading of the pathogen and keep the number of new cases down. So as I said, this is a rather unfamiliar situation for me. While I criticize our governments for not doing enough and not seeing the danger early enough when I already warned, and many others of course, were already warning people from this thing. But now at this point where we are, I must say that I overall agree with what the government is trying to do now. But as always in these cases, only afterwards will we be able to see if that was the right decision or not. Let me know, as always, how things are in your country in these regards or concerning these issues. And for more updates, I also recommend that you subscribe to my Telegram channel. Link is down in the description below. Stay healthy and stay safe wherever you are. Servus, Kameraden.